Hey friends, today we're going to talk about something really important, medical myths and misinformation online. As both a PA and a mom, I know how overwhelming it can be when you're searching for answers about your child's health. Let's break this down into some common myths I see all the time. The internet is absolutely packed with parenting advice, isn't it? But here's one thing. There's lots of great information out there, but there's also plenty of outdated, misleading, or just plain wrong information. Let's play a little game of truth or myth with some common claims I see floating around. Here's the big one I hear constantly in clinic. Green snot means my child needs antibiotics. Actually, that's a myth. Colored mucus is totally normal during a viral cold. In fact, the color change is often just a sign that your child's immune system is doing its job. Viruses don't need antibiotics. Only bacterial infections do. Now, that doesn't mean you should never worry about nasal discharge. Here are some specific signs that tell you it's time to check in with your healthcare provider. These include thick discharge for more than 14 days without improvement, sinus pain or swelling or redness, a fever that returns after going away for more than 24 hours, a high fever that doesn't go away, difficulty breathing, thick, greenish, or cream pus-like discharge lasting more than 10 days, coughing up blood, or nosebleeds that don't stop quickly. I love giving parents clear guidelines like this because it helps you feel more confident in your decision making. Here's another popular one. Cold weather makes kids sick. While we do see more illnesses in the winter, it's not actually the cold temperature making kids sick. It's viruses. And the reason we see more in the winter? Kids are spending more time indoors and sharing those germs like they're trading Pokemon cards. Since we know those germs are coming, let's talk about what actually works to prevent getting sick. These aren't fancy secrets. They're simple, evidence-based strategies that I use both in my own home and I recommend in my clinic. One is washing hands regularly. It's still our superstar defender. Also, getting enough rest and staying hydrated are key players in keeping those immune systems strong. Eating healthy to keep immune systems working to their full potential is important. And if you're not feeling well, please stay home so you don't spread the germs. Also, stay up to date on immunizations. Vaccines help to prevent those illnesses or to lessen how severe your symptoms are if you happen to get those illnesses. Now here's a big one that surprises a lot of parents. The truth about cough syrups for kids. Despite what you might have seen at the pharmacy, cough medicines aren't recommended for children under 6 years old. Not only are they often not helpful, but they can actually cause serious side effects. So, what do you do instead? Let me share some safe evidence-based ways to help your coughing kiddo feel better. My personal favorite, as both a PA and a mom, is a warm mist from a steamy bathroom. It's like giving those irritated airways a gentle hug. And for kids over a year of age, honey has actually been shown in studies to work better than many over-the-counter medications. Just remember, no honey for babies under a year of age. Here's the big takeaway, friends. Just because something pops up in your social media feed or appears in a mom group doesn't mean it's accurate. Your child's health is too important to trust random internet posts. Think of it this way. You wouldn't take financial advice from anonymous online sources. So why would you do it with your child's health? Always look for information from a qualified medical expert and trusted organizations. I want to be your go-to resource for sorting fact from fiction when it comes to your kids' health. Have you seen a health claim online that makes you raise an eyebrow? Drop it in the comments below. I'd love to help bust some myths. Don't forget to subscribe to my channel for more evidence-based pediatric advice you can trust. Remember, I'm here to combine my PA knowledge with real mom experience to help you feel more confident in caring for your little ones. And as always, friends, remember, this is educational content to help you feel more informed, but it's not a replacement for your child's healthcare provider. For specific concerns about your child, always check with their medical provider who knows their complete medical history.